Hey folks, we're back. I'm your host, BKP, and we're at Circuit World in Blue Ridge. We want to thank Georgia Cancer Specialist, Northside Cancer Center. Everybody could see your tie. They could see this tie.
I saw it.
Welcome, Justin. This is not Dr. Ray Tibbetts.
No, but and you notice his shirt's not a test pattern, and he doesn't have any purple socks on or anything.
But I mean, we come on the air, and you're going like this, like people can't see that tie. Oh, but anyhow, I promised you that you were going to meet one of the famous Buckhead boys. Congratulations. We talked about that, but this past week, I want to give a shout out to Northside Hospital. They wrote something very nice about that and posted at Northside Hospital about you being named the Buckhead boy, getting that award. And share that again with us this week.
Well, basically, this is probably not politically correct for nowadays, but the Atlanta used to be a small city, and the people that were the movers and shakers in it lived in Buckhead.
Right.
And they were educated in Buckhead. So for about the last 70 years, these old people that Johnny Isaacson, the senator, and Charles Weltner, the House of Representatives, and the presidents of all the banks and the founders of Children's Health Care and all that have been each year they would find somebody that had done a lot of really good stuff, mostly volunteer stuff or leadership stuff in Atlanta, and honor them as the Buckhead Boy. And the Buckhead Boys was a poem written by Charles Dickey, who was the poet laureate of Georgia and who wrote the book Deliverance and was a well-known artist, and he was a Buckhead boy. In the 60s, he wrote this poem about the Buckhead boys, and that's how the group got started. So I've gone to it for years, and I always thought to myself, boy, I sure would like to win now, man. I'd probably choose me, but I haven't done anything. And I guess we're dying out, and the group was smaller, so I got it this year. I was quite honored.
Very humbly say, I got it. Congratulations.
Yeah,
it was a great picture, you and your wife at the presentation.
With that picture, by
Absolutely.
the way. That picture was drawn 70 years ago, and by the guy that was the founder of Mad Magazine, who was a Buckhead boy. And that picture is a copyrighted, very special picture that the original sold for tens of thousands of dollars at an auction many years ago, but he gave the Buckhead boys the total right to all the money that comes from it in the future from anybody using it, and that is the picture that they had there. And every year that picture is given to you with your name on it.
Well, we thank you very much, and we're very honored here to have the recipient of the Buckhead Boy Award this year, Dr. William Whaley. Let's move along.
You want to ask some questions now?
I'm not. I can't read half these words.
All right. Okay.
I don't know who is typing some of these words.
Well, I mean, the truth is, I'm typing the words, but it comes in from the the patient. But this first question, I think, is a really good question. We discussed this case clearly once before. It says, my wife is a 64-year-old, and 4 months ago, you answered a question about her mass in the kidney, and you suggested that she have it removed and not have a biopsy. Now, you remember that? We said, look, that's clearly a malignancy.
Right.
To biopsy it, you got some hazard from the biopsy, so get it out. It says, you were right, and 90 days ago, a stage 3 clear cell cancer was removed and extended into the hilar structures. Now, I'm going to show you what that means in a minute. And no lymph nodes were removed. So that says two things. One, it was a locally advanced tumor, and the surgeon did not do a full dissection of the regional lymph nodes, so you would have an idea whether or not it had spread to those nodes. So if you don't remove them and get to look at them under the microscope, you do not know if they were involved. But the fact that it had grown out into sort of the roots of the kidney, and I'll show this in a second, means that it was locally advanced. And stage 3, they ain't but one more stage, and that's 4. That means it's,
Right.
The lights are out. So yesterday she saw a medical oncologist who says he knows you And he said, quote, "You are fortunate. A new immunotherapy adjuvant treatment has just been approved. What do you know and what do you think she should do?" He has ordered a PET scan. Well, first of all, I'd tell you, do what the oncologist tells you. Go on and do the PET scan. But he's exactly right. So let's show that first thing there.
Before we get too far into answering that, thank you for these great questions. But, you know, you bring all this great information. Do you have anybody in your research department that maybe assists at any time with any of this?
In this part, no. No, I do this all by myself. But I do draw on in the second.
I thought some of the graphics, I thought some guys sometimes help find some graphics and stuff.
No, nobody. He doesn't find it. Oh, no. You do get, when I come in here with a page out of the NCCN guidelines, he gets those. I tell you, I'm the klutz at getting the right page. He does get those.
Okay.
But I haven't had one of those.
No, I know you do the research.
I haven't had one of those in weeks. So he does. He's the guy that tells me what to do. I told you. And he gets the NCCN guideline, and then he says, "Okay, this is what the NCCN says you ought to be doing. Now, do we want to do this or do something else?" I mean, that's his job.
Okay.
All right.
We're going to get into his job in a minute.
First show, come on, let's go back to work. So this is kidney cancer. Historically, I remember 5 years ago, we had a woman who had a tumor in her lung that was found on X-ray. She was 90 years old, and she had a kidney cancer, had never been diagnosed, and she got followed for 7 years and never got treated at all because it was really, she was at symbiosis with it, and she died of heart disease. And it didn't need to be treated. So way over here, you've got slow-growing kidney cancer. It doesn't give you much trouble. But if you get kidney cancer like this in a relatively young person and it recurs, we didn't have anything you could do for it. I mean, we had various, chemos weren't any good, and then we began to come up with some sort of not immunotherapy, but targeted therapies that were not terribly effective. So kidney cancer has been sort of a bad actor, and it has changed significantly in the last year or two. And you can pull that down now. And remember, we've said that if you watch the checking out in the Ingalls, and if you look up any magazine that's talking about cancer and breakthroughs, it doesn't talk about surgery or radiation anymore. It talks about genetic therapy and targeted therapy. So put that next one up. Does anybody help us? I pulled this right off of a memo that was sent out to us in our group about 10 days ago you see, got that up there? And this renal cell, it says, this is newly approved within the last 2 or 3 weeks. Pembro, that's the Jimmy Carter drug we talk about all the time, is indicated in stage 3 or greater. Well, I'll be darned. Okay, put that down. So this patient, we'll show in a minute, has locally advanced significant risk of recurrence cancer. And until 15, 20 days ago, there really wasn't an approved immunotherapy to be used in this situation. It was approved only when it had recurred and showed up in lung or something, okay? You ready? You got the next one? Show those multiple kidneys there? All right, so this pretty red picture here. Different stages, but you see the kidney is shaped sort of like a horseshoe, and the artery and the vein come in there, and then the drainage is down here. So the hilar is this, and the fact that it invaded the hilum means that it was probably in the artery and the vein, and that when that happens, you really want to go out here and get all these lymph nodes that are around it, because if those lymph nodes were involved, then it would have been stage 4. But we don't know that. So pull that down now. So what did the oncologist do? Tell me what the oncologist did? He ordered a PET scan. So he wants to go look at those regional lymph nodes. It might change the staging. Okay, go up that pie chart. So this is all of the kidney cancers. You look at here, so many kidney cancers nowadays are generally fairly early. You see, the biggest part of that pie chart is stage 1 and stage 2, and then so that all that area of there is early stage kidney cancer. Stage 3 is only 16% of all kidney cancers. I can pull that down. And kidney cancers aren't all that common anyway. I mean, common things are common. So what is it? It's lung, breast, prostate, lymphoma, you know, and colon. It's not kidney. So getting yourself, what's that, BKP? Get the next one up there.
That is a
survival curve. I have to have a survival curve.
And we have an algorithm.
Well, it'll come right behind it here. All right. So if you look at these, you don't really have to pay much attention to it. But you'll notice that on the left, you've got there's 4 different lines, and they're stepped down, and the survival of stage 3 kidney cancer, this goes way out to 5-10 years, is up here about 60%. So 40% of them don't do that terribly well. Pull it down. You still with me?
Yes.
So now just imagine it's breast cancer or colon cancer, and we want to diminish the percentage of those that recur. What do? We give them hormone therapy for breast, or maybe chemotherapy, or give them some Jimmy Carter drug if it's lung cancer. So let's talk first of all about the surgery that she had. Up until the last decade, maybe 5 years, you got that next one up there? To get this thing out, they used to do a huge incision that went all the way from your belly button to your backbone. And then everybody who had that ended up with a big incisional hernia over here because you've cut every muscle in the side of your abdomen.
Right.
You got a really good operation because you got your eyes in there and you can remove it. But there's always, you can pull that down there would always be a long-term effect, and that generally was the operative place in the abdomen that would have an incisional hernia. We just had a patient that had to go get that fixed. It got so big. He had
You're weak in that muscle.
Yeah, and he had a lot of storage fat underneath the muscle that kept pushing it out there. So we got to always have a blood and guts picture for his BKP. So this is how the
Yeah, I looked at that picture this morning.
Okay, but you look real carefully. Now, this is a belly button right up here. Okay. And these are trocars. There's 1, 2, 3, 4, 5, and here and a little
entry points.
Entry points, correct. And at the bottom, it's a little bit wider because they're going to use their fingers there. It's called a hand-assisted laparoscopic nephrectomy. But they're going to take that whole kidney out without having to open up that abdomen from the belly button to the side. And each of these punctures is just, when they pull that thing out, you're not even going to see it. That's a pretty good size hole there. But what they've done is they've made a little incision. You can pull that down now.
I know those very well.
I understand you do.
I have a couple of those.
I understand. You know, laparoscopic gallbladder and whatever. So
and you know, and I'm not trying to keep changing the subject, but it's amazing what we're doing now with technology and surgery, because years ago, gallbladder being removed was major surgery.
Oh yeah, they cut you from here to here.
Right.
And you were in the hospital a week.
My grandmother had her gallbladder, and that was major surgery.
You were in the hospital a week.
Yeah.
Well, my nurse practitioner that no longer works with me, John Daly, took her gallbladder out in Atlanta, and she was on the operating schedule at 7 in the morning. And she called me about 11:15. And I said, "Oh, are you in recovery?" She says, "No, I'm in LJ." That's where she lived. At 11:15, after going in the operating room at Big Northside, not Northside Cherokee, at 7 a.m., her gallbladder was out, and she was back at home in LJ 4 hours and 15 minutes after the operation started. Now, that was on a Friday. She was in the office on Monday seeing patients all day.
So I went in and I had to have my gallbladder taken out. Well, once they determined they were going to take my gallbladder out, I asked the doctor, could he schedule it on a Friday so I didn't miss work? I said, can you schedule it on a Friday so, you know, I could have the weekend and not miss work? Work's always been important to me. So I had it out on a Friday, had it scheduled, went in, had it scheduled out on a Friday. I'm not going to tell you that the doctor said I should do this, but I played golf Monday.
Good for you. My nurse came to work. All right.
Getting back.
All right, getting back.
I'm getting sidetracked.
What's this?
You didn't ask me what my game was that day. Go ahead.
No.
No, go ahead.
Did you lose? Did you find more than you lost?
Yes,
Okay,
that's how
great,
well I
good
did.
game.
Right.
All right, what's this called?
That is an algorithm.
Algorithm.
Yes.
All right, put that algorithm up. You don't even care, but this is an algorithm, and this will tell you different stages and what you can do. You can pull that down, but every one of them says Pembro at the top. And there's another drug called sunitinib, and so we don't want to get into that. But what they're doing for this patient is so state-of-the-art that this therapy did not exist. I'd say it didn't exist a month before Thanksgiving, let's say. Sometime between a month before Thanksgiving and today, this was approved by the FDA.
Wow.
Now, here's one more thing I want to say. It was approved under a what? Emergency use authorization. Why? Because there's only small numbers of people in that clinical trial that showed that it worked. And there are going to be years of gathering more data till you get up to 10 or 20,000 people who've taken it before the FDA will approve this fully. So when people are complaining about the COVID immunization being under an emergency use authorization, everything we get in oncology that's new is on an emergency use authorization, and some of them are fully approved within a couple of years. Some it's 5 years, and some are pulled in 6 months or a year because the data didn't support it. But once it looks like it's going to save lives, unless you want to wait 5 years, it's always an emergency use authorization. So let's go back to this lady here. They're doing the right thing. I would let the doctor do the PET scan and hope at the PET scan that the lymph nodes are all negative, and let her take the medicine.
Okay.
Got it?
Got it.
No more questions.
No, I don't have any.
All right, so now the next question is not going to have any algorithms or survival curves. It's going to have an open discussion by Ray Tidman, who's going to be taken over now instead by Justin, because this is his area. You hear Ray on this every week. So I'm going to turn it over to Justin in just a minute. My husband is vaccine averse. He is employed as a vending machine route man. Now that's important. And is out all day filling candy and drink vending machines. Now he's vaccine averse, but he's in the public all day, every day, and in lots of, I guess these are 7-Elevens doing this sort of thing. He is double masked, and other than work, he does nothing, meaning that he ain't playing golf and he's doing nothing else. He is 3 years post colon cancer removal. So that was back, 2019, 2018 or something. And in early 2020, he was supposed to have a 1-year colonoscopy. So that's almost 2 years ago. He canceled it in March 2020 because he would not go in the hospital for the scope. And then they canceled for a while. Remember, March was just about the time that COVID was starting and everybody was scared to death. So he said, I'm not going. I think it was late March or early April when the hospitals shut down and they wouldn't let you go get the thing.
I am picking up this question loud and clear.
We've talked about it.
We have talked about this for how long?
Okay. In September 2020, it was rescheduled. So that was going to be about 6-8 months late. And he canceled because he did not want to go in the hospital for the procedure. He has done the same thing in March and September of 2021. So that means that when he didn't go in September, they rescheduled it for March. When he didn't go in March, they rescheduled it for September. And now he's got it scheduled for March of 2022, which is, right after Christmas, I guess. I'm afraid he will cancel again. What should I tell him to do? All right, so I'm going to first just do a real quick thing about what you're supposed to do. And then Justin's going to take the ball and run with it. Okay, this is what's called survivorship. This is how do you follow patients after they have had cancer some of the things like with when you have the radiation for rectal cancer, they become impotent, and you have to give them testosterone, or if they've had lymphoma and radiation, you got to worry about their heart, and you send them to cardiologist. Remember, this is the survivorship, how you follow people. Okay, so put up that little one first. Okay, this first one is it's not from the NCCN, but this is basically the NCCN guidelines for the United States. It's not terribly important, but if you go to the colonoscopy part, it says colonoscopy at 1 year and then 3 years. And over here it says CEA every 6 months for so-and-so blood test. Okay, pull that one down. Okay, now here's a bigger one that includes other stuff. But doctor visit every 3 to 6 months, the blood test every 3 months, CAT scan once a year if recommended for reason, blah, 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 blah. Colonoscopy once at 1 year and again at 3 years. So same thing. Now get the next one. Now this one is even more interesting because this is different Western countries. What do they recommend in the UK? What do they recommend in Italy? And if you look at it, some of these people recommend liver ultrasound and CAT scans every 3 months and stuff. You can pull that down. That's where there's no insurance companies involved, right? That's where the government's got doing the work. You're in a cancer hospital in England or a cancer hospital in Italy. Nobody has to worry about the money. So they just bring you in there and do all these tests all the time. Now, the problem is getting into that system in the first place. So if you live out in the country somewhere, it may take you a long time to get there. So yes, if you're in one of these systems, even in Canada, where you are getting good care, they'll just cover you up with testing because they got you in there and nobody has to get anything pre-approved. I just sent an email this morning out about pre-approval. They want me to go and do an interview talking about my peer-to-peer experience, and I sent them a note and said, I don't do peer-to-peers. Justin does all of them. Call him. Yeah. He'll give you what you need to know. All right, so here's the part of the question that is Justin's ball. So it is, what should I tell him to do? So Justin, I'm going to shut up now, and you just give him, you give her what her laundry list of things she ought to do is. I'll begin by saying you can't tell your wife or your husband anything, and they ain't gonna follow your instructions. But go ahead. What can she tell him?
The short and sweet of it is he should get his colonoscopy. I mean, that's the most important thing he can do. But this is a risk assessment question. He's weighing his risk of getting COVID in a hospital versus him getting COVID outside, working with the public, wearing a mask. And if you remember the Bangladesh study, said that one mask, a surgical mask, decreased your risk of contracting COVID to 11%. You were 11% less likely to catch COVID wearing a single surgical mask.
Properly.
Yeah. He's wearing a double mask, but he thinks that he's less likely to get COVID filling candy and drink vending machines than going into a hospital or a facility like down in LJ where all they do is colonoscopies and endoscopies. So his options are suck it up and get your colonoscopy, or he could get a vaccine, but the fact it doesn't give us his age, and it also doesn't tell us if he had chemotherapy or not, which would affect his
whether he's overweight
or how much antibodies he would develop if he did get a vaccine. But what is he more likely to die of? Is he more likely to die of a recurrent colon cancer, or is he more likely to die of COVID and contracting COVID in a 2 to 3 hour window, which it really shouldn't last 3 hours, but a 2 hour window in a hospital? Very much less likely. So, short and sweet of it, he needs to get his colonoscopy.
What's his biggest risk of death?
Right now, colonoscopy.
Colon cancer. Sure.
Yeah.
Chances. Let's say he got it. The chances he's going to get colon cancer in that hospital are less than 1%. I mean, after all, I think they're zero. But if he got the colon cancer, he got the COVID, he ain't going to die of it. I mean, the number of people that die of COVID cancer, of COVID's, I'm assuming he didn't have chemotherapy. Yeah. And she didn't mention that, so I'd assume he didn't. The percentage of people that die that have the disease is really small.
It doesn't tell his age either.
It doesn't. It doesn't.
And we've seen 30-year-olds with colon cancer.
Yeah.
We have patients in their 30s with colon cancer.
Yeah. But most of them are in their 60s and 70s.
Yeah, most of them.
So anyhow, that I was going to let Ray run with that, and you know that Ray would have begun by telling about your freedom and what was that? The autocrats telling you how to live your life. Ray, you're probably watching this from your deathbed.
I want to say something and respectful to the husband that's working every day. I respect that. Going out, you know, the husband and the wife asking the question. My wife gives me, when I go to the doctor, my wife gives me a whole list of questions that she thinks I should ask. You know. And I'm gonna say, I get the, do you want me to go with you? Oh God. And I go ahead and say yes. Oh, I'm in so much trouble. But I say yes, come with me, because God knows, and I don't say that tongue in cheek, only God knows that when I get out and you ask me what did the doctor say, and I translate it to you.
And then you'll say, did you ask him this?
Yes.
And you say, no, I didn't.
Yes,
He says, why not?
Yes.
You know,
so let me just
better
say
have
this.
her do it.
Right. So when I get out and I come back and she says, did you ask this? Did you ask that? What did he say? What did he say? All right. Well, I can explain to her what the doctor said in 15 seconds or less. Right? I'm a man. 15 seconds or less. She's not buying it.
No.
So here is my recommendation. I hope I can do this. If your wife wants to go to the doctor with you, let her go. Let her sit in a room and let her embarrass you by a couple questions if she has to. Well, he's been saying this. He's not telling you that, doctor. The world didn't end, right? The world didn't end. You might get a little red or whatever and like get out and say, why did you say that? But trust me, they care. This is the wife sending the question, right?
Totally.
This is the wife. So that's the reason I'm saying that. Let the wife go. Let the wife ask the embarrassing questions. When the doctor walks out of the room, you could always look over and say, why'd you ask that? I do that, all right? Don't ask that. But anyhow, all that being said, okay, go get the colonoscopy, all right?
And I'm also
go
telling
get the colonoscopy.
The guy's got every right not to get vaccinated.
Yeah.
If he doesn't want to get vaccinated,
if he
don't let it.
If he has concern, I sit here every Friday with Dr. Whaley and Ray Tidman for years. Okay, years. All right. So if I'm sitting here today and I'm giving a risk assessment, like I stayed at a Holiday Inn Express last night, so I could do a risk. Colonoscopy is here. COVID's here.
That's right.
Go get the colonoscopy. I hope I didn't say too much.
No, that's exactly right.
You know what I'm saying?
Absolutely.
Exactly right. But anyway, what I said was that Ray would.
Well, I see the wife sent the question, right?
Yeah, Ray would have begun
She's
by
concerned
saying
about her husband.
that there's a bunch of bureaucrats trying to tell the guy how to live his life, and she, and that's true, really. But at the end of the day, I would say, just like Justin said, go get immunized and then get your test. But actually, get immunized and get your test. Take him past March to get both of his shots, and so at the end of the day, let the guy go get his colonoscopy. He can wear a double mask when he goes in there, and his risks are not very great. So that's the end of that.
Hope I didn't get too into that question.
No.
All right, so. Oh, by the way,
Yeah.
put that down, man.
All right.
That is one ugly tie.
It is. Well, I didn't tell you the rest of it. Oh, yeah, but I wore it yesterday for ugly sweater day at our office.
Yep.
And I don't have an ugly sweater. I asked Jane, you got an ugly Christmas sweater? She says, I don't buy sweaters that are ugly. So I put on my ugly tie. It will fit in perfectly well for ugly sweater day, didn't it?
Yeah. Trust me, this is checking your color patterns on that very high-def TV.
That's Ray's job usually with his shirt.
All right, go ahead.
All right, now I usually bring you 5 things from the news. I got 36 things from the news today because so many of them are opposite of the first one is the UK reports the highest number of daily COVID cases since this business began. Yesterday was the highest number of positive cases in the United Kingdom since this began. That includes the original big surge and the Delta surge. And they are 90-something% Omicron. Now, that means the death rates aren't too terrible and the hospital rates aren't too terrible, but they've shut that daggum country down. Literally shut that country down. Then you flip over to this page. Many hospitals dropped the worker vaccine mandate. Well, obviously, a lot of hospital groups really were finding it difficult to enforce it. They were losing nurses and losing housekeeping and everything else. And that, didn't a court come out and say Biden can't do that to hospitals, hospital chains? So I'm glad that hospital chains, some of them have dropped it, some haven't. Northside never instituted it. And then you get this morning, Emory requires all students and faculty to have a booster. So one end you got reducing, you don't even have to get the shot at all if you're in a hospital, if you get tested, to a college telling you're 19 years old and you got to have the third shot. I mean, that's such inconsistency that it's just absolutely frightening. Now, I just pulled up the positive. How many deaths in Fannin County?
Well, what were we at, 141?
No. You were at 114.
114. I knew there was a
115 today.
115.
So there's been one a week for the last 3 weeks. So that really is remember we had a month with no deaths.
But of COVID?
COVID.
See, all right, this past week they've been putting the graphic all over TV, and they put underneath that 800,000 deaths. And then what did they say? From COVID. I don't believe it. I heard that.
You don't believe it?
Not when they do the from. I'm sitting here.
Okay.
Right. You want to say with.
You want to say with.
Right.
Yeah, okay, right.
This is the media, okay?
Right.
I sit here today
you're
telling you my dad died with COVID, not from COVID.
Right, he had COPD.
He had COPD, right. And I mean, I remember the last days.
It could have been H1N1.
Right.
It could have been H1N1 3 years ago. If he got H1N1 3 years ago, he might have died from it, just like COVID.
We were told the last year he was alive, we were told if he got pneumonia, that it could be the end. So this was before COVID. So I don't want to. I'm not saying I'm debating that. I'm just saying when you say one died last week, I get a little concerned if it comes out of COVID.
There's several other statistics that are totally different, though. If you look at the life expectancy calculations of the actuarials of the insurance industry. Now, remember, I was on the board of nationally traded, publicly traded insurance holding company for 30 years, so I understand the insurance business. And every year they publish the life expectancy tables at every age.
Right.
All right, so remember when Social Security started, the average man died at 57, the average woman died at 62, so they weren't going to collect Social Security at 65. Now women are going to 84, men are going to 77. 2020 and 2021 is the first years that the life expectancy tables in the United States have fallen. Well, the only thing that can cause that is the COVID epidemic and the shutdowns. So I'm not going to deny the fact that the suicide rate's gone up with the shutdown. More men may have killed their wives with it, but that's a tiny number compared to the number of people who got double pneumonia or pneumonia. When the patient of mine just died at Union Hospital yesterday, and the wife said, well, he died of double pneumonia. The double pneumonia was from the COVID. He's been in that hospital for 6 weeks with COVID, been in the ICU for a month with COVID, and ultimately he never developed the blood clots, but he developed this long-standing pneumonia. And we have people in our practice, people who practice in our practice, who had the COVID after immunizations a couple of months ago, who are still having long-haul COVID symptoms, and he just waved his hand. He's the guy. He's got long hair. He's been totally immunized. He had COVID Delta variant after the immunizations, and he's still got symptoms.
I had it 9 months after.
And he's still got bad
And
symptoms.
still, I developed myocarditis following COVID. Not after the
But
vaccination.
after vaccine.
Following COVID.
Yeah, but you were vaccinated before you got COVID.
Yeah,
That's correct.
Well before. 9 months.
9 months
Right.
before.
Yeah. Good.
I understand. So it was very
But
stigmatic.
yes, but it could have killed him if he hadn't had the vaccine.
That's what you say.
Well,
I understand. Okay, now wait a minute.
I can't help it. He's the one. You're gonna have to get on him over here. showing
He's
up.
in the green room. He's supposed to be quiet. Okay, now what's the number of positive tests this week? 9.8.
9.8.
Okay, it was what last week? 3.4.
Right.
And I said last week when it was 3.4 and it come up from 1.4 the week before, I said it's going to get to 10 within the next few weeks. Got to 9.8 in 1 week. Now I hate to be a seer.
You know, I'm waiting to ask my question.
I'm not going to be here for 2 more weeks, so I'm really interested what the first Friday in January is going to be like. I have to remember this for the first Friday in January. Go ahead, your turn.
Okay, so let me ask this question.
All right.
And I'm very serious on this. Okay. So I watched them find a case in South Africa. And I watched the media frenzy in Omicron, right? Say it for me.
Omicron.
Omicron, okay. I watched them find it in South Africa in the media frenzy, okay? And I watched at 5 a.m. when one of the networks reported we found a case in the United States. Now, I know the infection rate on different variants has been different. I get that. I've worked with you guys too long not to know that.
Yeah, this R0
right?
on this one is 8.
Right, okay. So, but what I'm saying, I remember just, seems like yesterday, we found a case, okay? Then I remember a couple days later, we found states from here to here.
Yeah, it's every state now.
Wait a minute. Now, how did it find, let me finish my question. How did it find Ithaca, New York? Is that Cornell University?
Yeah.
Okay.
Everywhere.
How did it find,
That's where my grandkids are.
how did it find Ithaca, New York? Now, I know it might have went up the thruway, but how did it find Ithaca, New York, infect 900 students and all 900 vaccinated?
Well, remember, it didn't start in South Africa, right? That's just where it was first found.
First identified?
First
Okay.
identified.
And the woman who identified it said, "Look, y'all don't need to go off. The sky's falling, chicken
Right,
little on you because this really isn't as bad as the rest."
How did it find Ithaca, New
It
York?
found Ithaca, New York for 2 reasons. One, Cornell has been the most vigorous in any college in the country. Remember, I got 2 grandchildren that are there. In their COVID testing. That's number 1. And number 2, it's a huge international university. I think a third of their graduate students are from foreign countries.
But they're vaccinated. They're the
That's
most,
okay. But
like one of the most
They
vaccinated.
They were 100%.
universities.
They were 100% vaccinated. So's Emory.
900
So's Emory.
breakthroughs.
I don't know why you keep coming back to this. I've already told you about the H1N1. Just
Right.
go back to H1N1. That year, if you'd been vaccinated, you only got 30% protection. That means 70% of people that were vaccinated could get H1N1 or got H1N1. I mean, this is not a new concept, that having the vaccine, you can still get the disease, but the disease won't be as severe because you got antibodies that will be partially helpful and keep you out of the hospital and keep you from dying. So if you take everybody that got the Delta variant who was vaccinated, their death rate is 1/100th of the death rate of the Delta variant in the unvaccinated. 1/100th. 1/100th. So if 100 vaccinated people got the disease and 100 non-vaccinated people got the disease, the death rate in the group that was vaccinated is 1% what the death rate of the people that were unvaccinated is, period. That doesn't mean that the people that were vaccinated didn't get it, but they didn't end up in a Aiken funeral home out here.
And that's the only thing that matters is
Right.
mortality.
Are you going to end up?
I still have myocarditis, following my breakthrough infection, but I'm alive and I'm here. And I mean, who's to say if I hadn't been vaccinated if I'd still be?
You were sick.
I was sick. I was very
Well, you weren't any sicker than Ray was.
probably not.
No, Ray and Lee were both
Ray
sick.
was very sick.
Ray was sicker
very
than
sick.
hell. Now, he did not end up with myocarditis. He did not end up with long haul or lung syndrome. Neither one. And neither did Lee.
Yeah.
But they were sicker than hell.
Yeah.
But they didn't get in the hospital. And you didn't get in the
I
hospital.
didn't get in the hospital.
I thought Ray was going to end up in the hospital. But anyway, that's the
I'd
point.
much rather be here.
That's the point. Yeah, but the point is, yeah, you can get it, but your chances of ending up dead are not as bad as the guy who gets it who wasn't
I got a
vaccinated.
question, though.
Yeah.
I got a question. So, Justin, you had a breakthrough case. You got Delta, the
Yep.
Delta variant,
Absolutely,
breakthrough case. What did you do? Did you have treatment?
Oh, go ahead, give it.
That's a loaded question.
Wait, he had Ray's treatment and the hot and the.
So wait a minute. Go ahead. Go ahead.
So I had Ray's treatment just like he did, and
Right.
I tried the monoclonal antibody, but I had a reaction to it,
All right.
like 2 or 3 minutes in, which ended up with that was 3 ER visits.
Now that
reaction.
is uncommon. That's called an
Which is
infusion
extremely
reaction.
rare.
All right. So you had treatments, right?
Yeah.
Yeah, but he also took the ivermectin and the stuff that is off-label that Ray would recommend, and my wife has it at home. He took all that too. He took everything he could get.
I got it. I got it. But wait a minute. So, if you would have not been vaccinated, you would have went through that same treatment.
Yeah.
If you
I believe
had
so.
Delta
If I
and
had
you were
Delta.
unvaccinated, you'd have called Ray or whoever, and you'd have went through. We're calling it the Ray treatment.
Yeah.
Right.
You'd have went through
I'd
that,
have done everything the same.
and we don't know that you wouldn't still be here today.
No, but the fatality rate of people who do that is still 100 times greater than the ones that aren't. Now,
I guess
there's
my
no,
question
there's
is:
no
is
double-blind
the
study of the ivermectin
Is the
study.
treatment now better? That some of the treatment
Oh,
we
yes,
have
yes.
better. So I'm.
Plus, that new antiviral
Right.
oral that came out about 10 days ago, if that's taken at the right time, that's really effective against Omicron and Delta variant. So, what's the name? I forgot. It's got a long name. But anyway, that's been on the market about
Well,
10
I'm not
days.
afraid to go to a Christmas party. I'm not afraid to go to Christmas dinner.
Me either.
I will not. I am not flying. I'm driving.
You can't hardly afford the tickets.
Well,
you see what the prices of tickets are for Christmas?
I don't want to be a video internet sensation. If someone in my family chooses not to wear a mask and someone next to me reports that somebody, I don't want to be an internet
Oh man,
sensation
if they didn't
overnight.
wear a mask on an airplane, you'd
Right,
be an internet.
so we're going to drive, but I'm not in fear. We got
Both of us
yeah,
got to
we
get
got
to work.
Yeah, you got to get to work.
So he got
Ugly tying off.
he's got to get up there and tell me what to do.
Do you have a joke?
I don't have a joke.
Ray didn't email you a joke?
No?
Ray was supposed to send a joke.
What kind of a joke?
I don't know.
Oh, he's always got a
Ray's
joke.
always got a joke. He's fresh out of cannibal jokes, or his cannibals aren't fresh. One or the other.
There you go. You got Ray's joke. All right. All right. Let me just say one thing. We're not going to be here until January.
Yes.
I want people to have a really good Christmas holiday. Go to the bowl games, enjoy them. The craziness with kids wearing a mask and being 6 feet apart in the school when their parents are at the 100,000 in the Tennessee stadium just doesn't make any sense to me. But if you've got fine china, you got the elderly and stuff, protect those people and go on and have a great holiday.
What say you, Justin?
Raise fine china.
Absolutely. I mean, go live your life. Don't live in fear.
Well, we thank you always for coming and being with us. And Ray, we wish you and Lee well, Merry Christmas, and wish you and Jane well, Merry Christmas, and all your family. We know
You too.
You're headed down to Atlanta.
Yeah, I got
Go down to the big city.
You know, I won't be there, but I'm not going to be there for dinner one night. And I'm driving down in the morning, opening presents, and coming back. I like to be in Blue Ridge.
Huh? Yeah, but your presents aren't in Blue Ridge. You have to go where the presents are.
No, the grandkids. See, I have passed the torch now, and so they gather at my granddaughter's house in Atlanta, not gather at the lake house. We're not staying there anyway. But we've passed the torch. So the kids now are in charge of what we do, and they're
You just show up. You don't have to make the dinner, nothing. You show up and then go home.
That's it.
That's good. All right, folks, we're going to say Merry Christmas to our...
And Happy New Year.
And Happy New Year. And thank you, Georgia Cancer Specialists affiliated with Northside Cancer Center. I want to thank them. We're going to take a break, and when we come back, we'll have the All-Star Political Panel. You guys got to get to work.